I'm Dr. Rahel Klapheke at Parker's Paws Animal Hospital. On this cold, snowy day, we're going to show you how to give insulin to your dog or your cat. Always give the amount of insulin as directed by your veterinarian. Never change insulin doses on your own, okay? So the first thing you're going to need is your insulin. And all insulins are different. Some of them need to be rolled in order to agitate the material. Some of them will have a white film at the bottom of the bottle. This is saline, this isn't insulin, but I'm using it for demonstrative purposes. And they have to actually be shaken. The reason why you don't want to shake it too much is because it'll create air bubbles, and that will go into your insulin syringe. So once you get your insulin adequately mixed, you want to get your insulin syringe. Now it's very important to know which type of insulin syringe you use. In general, U40 syringes are used for veterinary insulin products, and U100 syringes are used for human products. So never interchange the two, and you want to memorize that, because if someone accidentally gives you the wrong type of syringe, the dose will be wrong. So it's really important to understand the dosing on your syringe. And so this is a low dose syringe, and as you can see, it is a U40, okay? So I'm using a U40 syringe, okay? And then these are the units of measurement. So this is gonna be 5 units, okay? And so I'm gonna demonstrate how to give 2 units of insulin so that you can see how we can measure it. So I've agitated my insulin. The first thing you do for the syringe itself is you take off the bottom, and then you want to take off the top, okay? I always like to break the seal because it's going to be easier to get your insulin into the syringe. So by breaking the seal, I'm going to take my forefinger and I'm just going to break the seal, okay? Now I'm going to show you, you want to measure at the top of the plunger. So here's the black part, this is the plunger. You don't want to measure here for 5, you want to measure here for 5. Okay? Okay, and then you want to count. So you want to see what each notch is, because it can differ on the type of syringe you have. So this is going to be 4 units, this is going to be 3 units, this is going to be 2 units, and this is going to be 1 unit. So I'm going to familiarize myself with that syringe. This is important because sometimes syringes change. Sometimes they're out of stock, sometimes they're the low dose, sometimes they're the normal dose. So you always want to familiarize yourself on the amount of the units per notch. Okay, so I've broken my seal, and now it's time to get the insulin in the bottle. So you take the bottle and you take it upside down. There is a rubber top to every insulin bottle. You want to put it in the center. I don't like to do this or to go at an angle, because you can bend your needle and that's going to weaken the needle. I always like to go completely upside down and go straight in to the bottle. So then I've already broken my seal, and I'm going to give 2 units. And my trick is to go to 5 units and then measure back up. And then this is going to try to get all the air bubbles out. So I'm going to go 4, 3, and 2. Okay, so I'm going to do that again so that you can see it. Go upside down, take the needle, go directly in, and then you're going to pull back, and you want to go to around 5. So that's my 5, and then I'm going to go 4, 3, and 2. And then I'm going to pull it directly out. Again, you want to go up and down so that you don't bend and weaken this needle. Now you don't really have to worry about a bevel, because to be honest, my eyes couldn't see it anyway. So another trick in giving your dog or cat insulin is to rotate. I like to tell my owners to go from the left shoulder to the right shoulder to the right hip to the left hip. This is my pet right here. Believe it or not, a towel feels just like skin. So the reason you want to do that is because if you go in between the shoulder blades or behind the neck on a regular basis, one, it's not a good vascular area. There's not a lot of vessels in that area to absorb in the fat the insulin, and 2, it's going to create scar tissue. So by rotating, you're going to be able to get good penetration and absorption of the insulin. So I'm left-handed, so I'm going to show you what I like to do. Some people create a tent like this. I don't like to do that because I end up poking myself. So what I like to do is gently pull the skin upward with my right hand. Again, I'm left-handed. And then I go at a 45-degree angle with the skin. And then I go like this to poke. And then I squeeze, okay? And then I pull out. You don't want to put alcohol or clean this area, because if you don't get the insulin inside the skin, you won't know if it's the alcohol or the insulin. Now, one thing, if you want to go close, Jamie, one thing you don't want to do, now watch what I'm doing here. You can go through the skin like that. See how the needle has come out on the other side of the skin. You don't want to do that. So that's why you want to go at a 45-degree angle like this, go through the skin, and then squeeze and then pull out. Okay. If you don't think you got it in, or if it got out or halfway in, skip that dose. Overdosing with insulin is always much more life-threatening and dangerous than not giving any insulin at all. If that occurs, then call your veterinarian immediately for advice. Also, I always recommend having only one person in the household give the insulin every day. What can happen is if there's 2 people in the household who are responsible for giving insulin, you're much more likely of accidental double dosing. And again, overdosing on insulin is always much more life-threatening than underdosing or not giving it at all. Also, your feeding guidelines, always follow your veterinarian's recommendations. Most insulin needs to be given during a meal. So while your pet is eating, that is a good time to, while they're distracted from the food, that's a good time to give the insulin doses. You can also have someone hold, and we've gone over restraint and holding in other videos. When in doubt, if your pet hasn't been eating, if your pet doesn't eat a full meal, contact your veterinarian for advice on if and when to give insulin. I hope this helps, and good luck. You're doing a great job with your diabetic.